Okay, so I'm Tomoko, and I'm cardiologist in Japan, and well, and thank you for the introduction, by the way. And so I'm cardiologist in Japan and transplantation, and my talk today is focusing on heart transplant. But I know you are the student, and so not so much specialized in this field. So I'm trying to skip some slides, which is very much in detail, but I just want to give you some detail, some idea about heart transplantation. Okay, so what comes to your mind when you hear from the word, hear the term heart transplantation? Well, actually, the first transplantation was done in 1967. It was the year before I was born, and then the first transplantation in Japan was performed the next year in 1968. This is the Times News. This is the journal, the front page, and just after the first heart transplantation. This is the Christopher Knight. And then, actually, this is me, and then I'm pregnant at that time, and then my daughter sitting there is inside of my tummy at that time. And then this is Professor Shamway. The first transplantation in the U.S. was done by him, the cardiothoracic surgeon. And then this was I first encountered cardiothoracic transplantation. Okay, and also you may know the news and then about xenotransplantation. Xeno means pig to human heart transplantation was done last year in the U.S. And this is first heart transplantation in the South African. So these are about 50-something ages. So this is the history of heart transplantation for these 50 years. And then now, heart transplantation is very so the prognosis is getting better. You know this, and he actually had heart transplantation. And these are the heart transplant recipients, and then they are very actively working. And as a soccer player, or golf player, or climber, professional climber. And so, if you see these pictures, you may think the post-heart transplant prognosis is very, very good. Well, yet, it is not always the cases. So, I want to talk to you how it is important to manage post-heart transplant and using the immunosuppressant and then infectious prophylaxis, that kind of things today. Okay, so let's talk about the number of heart transplantation. This is worldwide numbers, and this is Japan. Okay, the approximately 5,000 heart transplantation is done all over the world. In Japan, the number is about 50, but the number is now decreasing due to the COVID. Okay, and then before heart transplantation, many requires artificial heart or ventricular assist device, mechanical circulatory support devices, and then but the number of requiring and the mechanical circulatory support and over the worldwide is about 60% of patients require the mechanical circulatory support, and then in Japan, it is about 90% of the patients require mechanical circulatory assist device before heart transplantation. It is a huge difference between the country in the US or Europe, which heart transplant number is very the high, and then the heart transplantation is very few, such as in Japan. Many require mechanical circulatory assist devices while waiting for heart. And then the duration until heart transplantation is the donor comes and heart transplantation is possible. The waiting period in the U.S. is about 1 to 2 years, but in Japan sometimes over 6 years because of the donor shortage. And the survival is quite good, but it is I will talk this data later. But the survival is about the 10-year survival is about over 50%, and then Japan's and the survival in Japan is much better. And then, so actually, so I'm, as I was introduced, so I'm a member of the ISHLT educational workforce, and then actually, so organized the symposium called we use the word the Dirty Transplant Program internationally, and then this was like the concept of the message was like this, and then so these speakers, and then these are the member of this symposium, and then actually I brought the presentation from the Indian doctor, and then he talked about the transplantation in India. And the first transplant was performed in 1968 in India, and it was the 6th case in the world. And then, after the Transplantation of Human Organ Act established in 1994 in India, and then in the same year, the first heart transplant under the law was performed in India. And then after that, the 2014, a National Organ and Tissue Transplant Organization established. It is called NOTO, in India. And then, so, the Indian Society for Heart and Lung Transplant was established. And then, so, it was getting very active. The formation of I don't know how to pronounce, but IMSHLT is a big step for heart transplantation in India. But there are several programs in India about the heart transplantation, and the number is steeply increasing. And then the more than 700 transplant was done in all over the India, and then the survival is really good. But in the Indian, the survival after heart transplantation is better than the worldwide data. But there are the problems. Organ donation is so it is the increasing, but heart transplant is not so much. There is a steep increase after the society was established, but it is plateau now. This is because the nation is very huge, so it's very difficult to the organ transportation in India, and also the issue about the medical insurance. So that would be the key for your country to increase the number of transplantation and make the equal opportunity for patients with heart failure in this country, I think. And also, I want to talk about post-heart transplant. That is my job to take care of post-heart transplant recipient. Sorry. And then, so everybody, when I say heart transplant, so everybody focus on heart transplant surgery itself, but actually, the pre-transplant, there are a lot of things to do. So, and then the patient actually lives with heart failure, and the life thinking of death is approaching. And actually, while waiting, they have to wait for somebody's death. Somebody means possible donor. So, thinking about this, and then there are so many the drug therapies and also ventricular assist devices. So many things happen pre-transplantation. And post-transplant, so patients have to live with immunosuppressants forever until their actual death. And the life thinking and live with donor's life. And that they may think of the recurrence of heart disease, and then the infection risk, and then also they may inherit disease of nature, and then so they have to think that patient may encounter many problems, many issues post-transplant. So they have to live their life with immunosuppressant. So that is the very important issues when you become in the field of pharmacy. Okay, so actually, so I am taking care of the patient, and then I always have to think their life itself. So a low transplantation is to be the companion in the life journey of the transplant recipient. That is actually the message for me. Okay, so I talk about the details about pre and heart transplant surgery and post-transplantation.